sweetheart. I'm going to try to get as little gooey as possible.
It's not above your ears when you're down.
By lifting up her leg like this, it just allows you to get a different kind of view?
Yeah, I was going to try to get a different angle on this tendon. I may not be able to because her tendon is relatively small. But,
So what you're doing right there, doctor, by drawing on the computer, that you're outlining the area of concern?
I'm outlining the margins of the tendon to see how big it is, and we'll use that for a comparison to the opposite side. This tendon is still less than a square centimeter, 0.86. It's hard to imagine a tendon that small in a horse like this, but we do have a significant area of enlargement, but it still has it down about 0.86. I scanned one area or measured one area on the other side, and it was just about 0.65 or something like that. So in a horse like this, you expect these tendons to be really tiny. So anything you see, or anything that happens to make them big, is pretty significant. It changes quite a bit of the tendon. Starting into the tendon, let me blow this up just a little bit. So we've made our 3D box. Okay, this is our tendon, and we're going to scan, we're going to slice through that tendon right through the area of the injury. And we're going to see where the fibers on the outside around it are parallel, and we can see them. And then as we go further into the tendon, we come to an area here where we see fibers that are actually bent around this particular nidus right here. And this black stuff then is the hemorrhage, edema, and what have you that have occurred when the fibers let go in that spot. So, and then if we move a little bit farther, we can see some fiber elements in here that are intact, running through that. So the reason for coming back in 4 to 6 weeks is to see what's left in that defect. It may be that the majority of the fibers will collapse in there and you can still see them, and then you don't have as big an area to heal up. So you always have to come back. And aggressive treatment during that 4 to 6 weeks time is indicated, because if we leave that in there, then it promotes scar tissue. So this is the major site that we're seeing here. And then if we turn the tendon around this way and look at it again as we scanned it, then this is what the area looked like right here. And we just took our machine and sliced in this way to look at it. And that's the area of damage. So that's the bad guy. Okay, that's the thing that we have to take care of. That's why Hank is going to keep using the cold compressive therapy on this horse, hand walking only kind of thing, give this tendon a chance to rest, and then we'll recheck it, see where we stand. In the meantime, I'll go back through all the video clips, measure all the levels like I've done on your other horses, left and right, and we'll make a comparison chart then of area circumference. And then next time we look, then we'll relate back to those values and see what's changed in the tendons.
Okay.
If you walked up to this horse clinically and looked at the tendons and palpated them, you'd notice that on the right side there was an enlargement, primarily on the inside of the tendon. It's a little tender, but she's under tranquilizer now, so we don't know how much of it. But the left tendon looked pretty good throughout. Measurements will be taken later to document that everything is okay. Didn't see any focal fiber tearing or rupture on the left side at all. The right one looks good proximally, but it's bigger. I can tell it's bigger because I can see it on the scan. I'll go back and measure everything. And in the one area we measured, it was about 2/10 of a square centimeter bigger than the one measurement that I just did preliminarily on the other side. So in the area then, in the lower right tendon, especially on the inside, we have some areas where fibers have been ruptured. We've got some hemorrhage and edema that appears to be contained within the tendon. That is the main finding on this horse. And that's the site that we're going to concentrate on. We're going to treat the limbs with cold compressive therapy, recheck in about 4 to 6 weeks and see where we stand. So the prognosis is always more accurate on the follow-up scan. Some tendons, some ligaments actually get worse with time. But usually if we're aggressive in our treatment and jump on them right away and limit their activity and let them rest while we treat them, usually they do not get worse. But tendons that are where horses are turned out with free choice exercise or other therapies are used and they don't really monitor what's going on, those tendons can actually get worse in a 30-day period of time, which is one thing we're really going to prevent on this horse.
Thank you, doctor. One final question. We talk about cold compressive therapy. Can you explain
for those who
what
haven't,
that's
can we
actually
explain it a
doing in
little
terms
bit?
of the healing
When I slide
process?
down this tendon, the instruments that we have now circulate ice water. Some of them I'm looking at a fairly normal shaped tendon as I come down through the middle. When I get down to this area, with a cold compressive therapy, a device is put on the leg that's almost like a big blood pressure cuff. It doesn't get as tight as a blood pressure cuff when it's used, but it has a thing that sits on the withers. You can treat 2 legs at a time, and ice water circulates through that pad. And if you put one on your arm, the first thing that you feel is the coolness of the ice water, and then you see an incremental increase in pressure that occurs. It's not violent pressure, but it's a incremental increase in pressure that helps the lymph drainage and what have you, because horses stand up. They have venous congestion due to gravity, just like we do. That's why our feet are bigger on Friday than they are on Monday, is because we've been off our feet on the weekend, and when we stand around, our feet get bigger from congestion. And what we're trying to do in the wound is to reduce the amount of congestion, which will promote the normal blood supply and get it to heal.
Excellent. Thank you, doctor.
You bet.
Location?
No, we're not. We're right down here at the lower zone of the tendon. It's on